Hello and welcome. Today we're diving into a fascinating and often overlooked connection: hepatitis C, associated nephropathy. We'll explore how a seemingly liver infection can significantly impact your kidneys. Let's unravel this complex relationship and learn what you need to know. So, what exactly causes this kidney complication in the context of hepatitis C? The primary culprit is, of course, chronic hepatitis C virus infection. The virus, while primarily targeting the liver, can trigger an immune response that leads to the deposition of immune complexes in the kidneys. These complexes, formed from antibodies and hepatitis C viral components, essentially get trapped in the delicate filtering units of the kidneys, called glomeruli, causing inflammation and damage. In short, hepatitis C leads to immune complex formation, which then gets deposited in the kidneys. Now, let's delve into the pathophysiology, or how this damage unfolds. The deposition of immune complexes, specifically cryoglobulins containing antibodies that bind to hepatitis C virus, initiates an inflammatory cascade within the glomeruli. This inflammation leads to thickening of the glomerular basement membrane, proliferation of cells within the glomeruli, and ultimately scarring, also known as glomerulosclerosis. The glomeruli's ability to effectively filter waste products from the blood is then impaired. This damage manifests as protein leaking into the urine, decreased kidney function, and eventually can lead to kidney failure. The entire process is driven by the persistent immune response to the chronic hepatitis C infection. Understanding the prevalence of hepatitis C associated nephropathy is crucial. While not everyone with hepatitis C will develop kidney problems, it's a significant concern. Studies suggest that a substantial percentage of individuals with chronic hepatitis C, ranging from 5% to 20%, will experience some form of nephropathy. The actual number can vary based on factors like ethnicity, genetic predisposition, and the duration and severity of the hepatitis C infection. Certain populations, such as African Americans, appear to be at higher risk. It's important to note that many cases may go undiagnosed, highlighting the need for routine kidney function monitoring in patients with hepatitis C. The signs and symptoms of hepatitis C-associated nephropathy can be subtle and may not appear until the kidney damage is quite advanced. Some of the most common symptoms include proteinuria, which is the presence of excessive protein in the urine, often leading to foamy urine. Edema, or swelling, particularly in the legs, ankles, and feet, can occur due to the kidney's inability to regulate fluid balance. Hypertension, or high blood pressure, is another frequent finding. In advanced stages, fatigue, loss of appetite, nausea, and other symptoms of kidney failure may become apparent. Because many of these symptoms can be attributed to other conditions, it's critical to consider hepatitis C as a possible underlying cause, especially in at-risk individuals. Diagnosing hepatitis C-associated nephropathy involves a combination of clinical evaluation and laboratory testing. The process typically starts with a urine analysis to detect proteinuria. Blood tests are performed to assess kidney function, including measuring creatinine and blood urea nitrogen (BUN) levels. Further investigation often includes serological tests to detect cryoglobulins, which are immune complexes that are characteristic of this condition. A kidney biopsy, where a small sample of kidney tissue is examined under a microscope, is often necessary to confirm the diagnosis, determine the specific type of kidney damage, and rule out other causes of kidney disease. Hepatitis C-associated nephropathy isn't a single uniform disease. There are several different types, the most common being membranoproliferative glomerulonephritis, often abbreviated as MPGN. This type involves thickening of the glomerular basement membrane and an increase in the number of cells in the glomeruli. Other less common types include membranous nephropathy, focal segmental glomerulosclerosis, and immunoglobulin A nephropathy, also known as IgA nephropathy. The specific type of nephropathy can influence the treatment approach and the overall prognosis. The treatment and management of hepatitis C-associated nephropathy involves a two-pronged approach addressing the underlying hepatitis C infection and managing the kidney disease itself. Direct-acting antiviral agents, or DAs, have revolutionized hepatitis C treatment, offering high cure rates and often leading to improvement in kidney function. In addition to antiviral therapy, immunosuppressive medications, such as corticosteroids or rituximab, may be used to suppress the immune system and reduce inflammation in the kidneys. Managing kidney disease involves controlling blood pressure, restricting protein intake, and using medications to reduce proteinuria. In severe cases of kidney failure, dialysis or kidney transplantation may be necessary. Preventing hepatitis C-associated nephropathy is primarily focused on preventing hepatitis C infection in the first place. This includes avoiding risky behaviors like sharing needles for drug use, practicing safe sex, and ensuring that blood transfusions are screened for hepatitis C. For individuals already infected with hepatitis C, early diagnosis and treatment with direct-acting antiviral agents can significantly reduce the risk of developing kidney complications. Regular monitoring of kidney function in individuals with hepatitis C is also crucial for early detection and intervention. The prognosis for hepatitis C-associated nephropathy depends on several factors, including the severity of kidney damage at the time of diagnosis, the response to antiviral therapy, and the presence of other underlying health conditions. Early diagnosis and treatment of hepatitis C can lead to significant improvement in kidney function and prevent progression to kidney failure. Recent research has focused on identifying specific biomarkers that can predict the risk of developing nephropathy in individuals with hepatitis C, as well as developing more targeted therapies to suppress the immune response in the kidneys. The development of new direct-acting antivirals has dramatically improved the outlook for patients with hepatitis C and associated kidney disease. Ongoing research aims to further refine treatment strategies and improve long-term outcomes.